Hi, Dr. Kim. This is Kristen McGinnis and the rest of Group 3 doing our discussion 2 for CST 106. Today we are going to talk about voice therapy. First, we are going to explain what voice therapy is. Then we're going to talk about 2 different disorders of the voice and then the therapy that would go along with those 2 disorders. So to start us off, I'm going to pass it over to Erica.
Hi, Dr. Kim. So my name is Erica, and I will be covering voice therapy. And first, I'll start with the definition. Voice therapy is a behavioral treatment shown to be both useful in adjunct to medical intervention and is effective also as a primary treatment. And I got that from the American Speech Language Association. And there are 3 different types of voice therapy. The first one that I would go over is hygienic approach. And that therapy eliminates any negative behaviors and habits that are harmful to the vocal mechanism. And that vocal hygiene is a component of several programs used all over the world. But the real contribution of that is inconclusive. But even in observance, some rules may produce small positive changes. So it is a therapy. And the basics of vocal care are shared among many countries. So the second type of voice therapy is systematic approach. And that approach is directly with modification and altered of vocal characteristics. And the last one is the physiologic approach, and that approach is holistic treatment with retraining and rebalancing breathing, phonation and resonance subsystems. And one specific treatment that I would go in depth is the Lee Silverman voice treatment method. And that has been demonstrated to be the most effective method of treating the lower volume, lower energy, and rapid rate of speech in persons with Parkinson's disease particularly. And of the 3 methods that I mentioned before, the Lee Silverman is the strongest, and change has been found for the physiologic approach based on improving the vocal fold closure. And this method was developed 20 years ago by Ramig and colleagues, and it is a specific voice therapy that has generated a global interest among clinicians and researchers because of its powerful effects on various aspects of voice and speech in individuals with Parkinson's disease, as well as with various neurologic disorders. And according to the authors, this method is delivered in an intensive regimen and in a manner consistent with theories of motor learning and skill acquisition, as well as with principles of neuroplasticity. And it is a high effort, healthy loud phonation method to encourage maximum phonatory efficient and co-activation and coordination of speech subsystems. And this may be the most international of all modern approaches in treating a specific voice disorder. So now we're going to move on to Regina.
Hi, Dr. Kim. My name is Regina Kogan, and I'll be talking about spasmodic dysphonia as well as foreign accent syndrome today. And all of my information has come from alliancehealth.org, the National Institute of Health, and the National Institute of Deafness and Other Communication Disorders. I'll start with spasmodic dysphonia. Spasmodic dysphonia, also known as laryngeal dysphonia, is a neurological disorder usually classified by voice sounds that are atypical. Dystonia is an umbrella term describing involuntary contractions and spasms of muscles that are either localized or widespread. In the case of spasmodic dysphonia, the spasms are localized and task-specific. Spasmodic dysphonia targets the laryngeal muscles only when the patient is trying to speak. When the patient uses the same muscles to breathe, swallow, or complete other laryngeal tasks, the muscles perform typically. Typical symptoms of spasmodic dysphonia are classified in two specific classes: adductor spasmodic dysphonia and abductor spasmodic dysphonia, which forces open and close the thyroarytenoid muscles, causing straining, breathy sounds, pausing, and trembling of the voice. While the cause of spasmodic dysphonia is largely unknown, scientists know that the disorder presents and begins in the basal ganglia. The treatment for spasmodic dysphonia are a trifecta of speech pathology, medical therapy, and surgery under the direction of a medical specialist. The second disorder that our group will be talking about this week is the foreign accent syndrome. Foreign accent syndrome is the rapid onset of foreign accent brought on by trauma to the brain. Symptoms include elongating vowel sounds, discrepancies in syntax, improper oral placement, and describing using improper words. As mentioned above, foreign accent syndrome is caused by trauma to the brain, which includes, but is not limited to, stroke, which is the most common, along with traumatic brain injury, multiple sclerosis, and brain hemorrhage. Oftentimes, foreign accent syndrome can be linked to apraxia and aphasia. Treatment for foreign accent syndrome can be speech therapy and often therapy to deal with the psychological changes due to the new identity. And next, I'll be sending it on to Nina.
Okay, thank you, Regina. My name is Nina, and I'm going to be talking about the therapy on dysphonia. Before I start, resources I used are NetDoctor, and it was an article by Michael Lee from 2005. And I also used a technical report from ASHA. So a lot of things I'm going to talk about, Regina and Erica kind of already covered, but I'll go a little more in depth. So dysphonia just means disorder of the voice. The dys means disorder, and then phone at the end means voice. So a couple of the causes could be inflammation of the larynx, lumps on the vocal cords, which is obviously pretty common in singers, trauma or lesions on the vocal folds. And the most common symptoms for this are hoarseness, sore throat, and dry throat. So there are a couple treatment options for dysphonia. Besides speech therapy, there is conservative therapy. So pretty much that's just to eliminate things that can cause the symptoms or make them worse potentially. So some of those things could be stress, smoking, or alcohol. And they also recommend to rest, do not talk or whisper, and drink a lot of water. If that doesn't work, there's also medical therapy, which is obviously medications like antibiotics. And also there's surgery to remove any tumors that could be on the larynx or the vocal folds, and that would be a microlaryngoscopy. So the main one is speech or voice therapy, and it all depends on the kind of dysphonia that you have and the intensity of it to pick which one works best for the dysphonia you have. But the SLPs will coordinate with the other medical professionals to develop the best plan for that dysphonia. So for speech therapy, it's mainly used for vocal cord nodules and voice misuse, and it is the main treatment of choice for dysphonias. So there's direct approaches and indirect approaches. So for a direct approach, you can focus on manipulating the voice producing mechanisms, which could be phonation or respiration, or to modify vocal behaviors, and that's just to establish a healthy voice production again. And then if you went an indirect approach, you would modify the cognitive and behavioral behaviors in which the voicing occurs. You also could educate the patient and give counseling for identifying strategies to improve their voice quality. So one of those approaches is called a physiologic voice therapy, which we already covered a little bit, but those are treatments that directly modify the vocal mechanism. One of those is called expiratory muscle strength training, and that improves the respiratory strength during phonation. So there's like a bunch of different exercises that are done to do that. And another one is called phonation resistance training exercises. So that's producing an ah sound with loud maximum sustained phonation, or producing ah with loud ascending and descending pitch glides over the entire pitch range. You also can produce functional phrases using a loud and high-pitched voice, and produce the same functional phrases using loud and low-pitched voice. So those 4 examples are examples of phonation resistance training exercises that can work to help the dysphonia. And there also is a symptomatic voice therapy, which pretty much is just a modifier to the deviant vocal symptoms that occur with dysphonia. So as you can see, there are a lot of different therapies that can help dysphonia, but it all just depends on what kind of dysphonia it is and the intensity of it. So that's all I have to say. We'll pass it off to Kristen.
All right, thank you, Nina. So I'm going to briefly go over some of the voice therapies for foreign accent disorder. This is a very interesting one because some people still debate on, and Regina touched on this a little bit, but people debate on the extent to which we work on or it is real. And what I really noticed in all of my research is that the most important thing for this is to kind of have a team approach to therapy. And the speech language pathologist is one of the most important members of that team. Some things that can be done are, some treatments are going to be teaching how to better move your lips and jaw during speech. So you kind of have to slow down your speech, break it down, and teach people like the finer movements of their lips and their jaw and their phonation. And then because there's something that came up a lot as well, that there's a lot of emotional counseling that'll come with this, because most of the time this isn't a disorder that someone's just born with and they deal with. Obviously, it's something that comes on because of an event. And because of that, that event sort of needs to be dealt with. So I found that from the ASHA website. And then I also found a source from the UNC Health Department. There are these 2 doctors that did a presentation on foreign accent syndrome. There's Dr. Haley and Dr. Helm Eastbrooks, and they spoke about 2 different therapies that they've done, and their biggest point was to do like long-term therapy. So they did 3-hour intensive therapy for accent modification, and then 4 individual 45-minute therapy sessions. And that their biggest thing was just kind of repetition. So they explained to the patient what was going on phonologically with them. They audio recorded and would review and self-critique together, and they noticed a big change with their patients. So I thought that was really interesting to see 2 points of views from people that have actually done the therapy. There are a lot out there, but the biggest thing seems to be putting time into this one and practicing different strategies for modification of how you say things. All right, so thank you, everybody. I think you all did a great job. Does anybody, all 3 of you, have any questions about what any of us have said?
No.
No? Well, great. That was awesome. I thought this was a really interesting topic to research. So thank you to you guys for putting in so much work and communicating with me. And then thank you, Dr. Kim, for listening to our discussion too.